Welcome to the Experts in Sport podcast, brought to you by the School of Sport, Exercise and Health Sciences at Loughborough University.
Today I'm with Dr. Mhairi Morris, and we're going to discuss the recently NHS-approved drug Anastrozole and its potential role in preventing breast cancer. We'll look at what the drug does and who might benefit from taking it. We'll also discuss the role that exercise and diet can play in helping prevent breast cancer. So, hi Mhairi, thanks for coming on the podcast.
Thank you very much for having me again.
Yeah, again, exactly. It was a while ago. We had you on, and I digged into some research. It was episode 24, and it's quite a while ago. And for those who haven't heard you before, you can provide with a brief introduction. But for those who want to listen to episode 24, we did touch upon exercise, the immune system, and cancer. We might repeat some of that today, but there's probably some more in depth on those specifics. Especially around the immune system, if people want to listen to it. But for those who haven't heard from you before, can you just give us a brief introduction of your background?
Sure, absolutely. So my name is Mhairi. I've been at Loughborough since 2017. I originally trained as a tumour virologist when I did my PhD in Birmingham, which basically meant I worked on a very rare cancer that's linked to a specific virus that most of us have, Epstein-Barr virus. And so at that time, maybe rather ashamedly, I thought you got cancer, you took chemotherapy, surgery, radiotherapy, whatever, and then you either got better or you didn't. I had no real concept over the notion that we could do things to prevent cancer. And it was when I joined Loughborough 7 years ago that it opened up a whole new world to me. And so I started to explore the role of exercise and how it can prevent cancer, how it helps cancer patients to rehabilitate as they're going through treatment, and it helps to prevent secondary metastases as well, which of course is the big killer in the cancer field. So yeah, that's me.
Excellent. And what you're currently working on some projects beyond the lab?
I am, yeah. So since I joined Loughborough, we developed a novel 3D in vitro model. So I'm really interested in, I'm a visual learner, so I really like to picture things in 3D. So we've done this in the cells, but I've also got a project where we're trying to 3D print a tumour from a patient's scans and see if that can be helpful in helping them communicate with their loved ones. And I've also got a potential CrossFit intervention in breast cancer survivors. It's a collaboration with somebody at Nottingham Trent University. Her name is Dr. Atherley Redwood Brown. We happened to just meet each other at a conference, got chatting and thought we should do something together. And a few weeks later, we submitted a bid to the Royal Cancer Research Fund. So hopefully, watch this space, we'll see. We'll get some money to perform this CrossFit intervention.
Hopefully, and I did see that in the notes prior to his meeting, and unbeknown to you, I am a CrossFit level 1 coach.
Really?
I am. I was the first coach to help at CrossFit Nottingham, and this is back in I think 2011 maybe. Okay. I might be slightly wrong. It was around then, and I know Atherley. I met Atherley at CrossFit Nottingham, and I know she went on and opened a box at Derby, so she owns that with her husband, who I also know. And I think she's also opened something around cancer. Do you know more about what she's done with her box there?
So I know that she did an intervention. Well, she did an intervention with young cancer survivors and looked at the impact of CrossFit on their physical and mental health. But she also did a questionnaire study where she got responses from all her CrossFit, people who do CrossFit basically. So they're not a particular cancer population, they're just the general population, but then looked at the impact that it had on their medication use, on their other symptoms for things like anxiety and depression. And I think there was something like a 62% reduction, or might have been 65%, it was a lot, reduction in medication use and a 40% reduction in medical appointments for other illnesses, not cancer related, just from using CrossFit.
And that is very interesting. And you may or may not know, I also own a gym. I nearly opened CrossFit Nottingham West with the CrossFit Nottingham owners. Long story short, we didn't do it in the end. Years and years later, I then opened a gym. It's now about 4 years ago. So we opened a gym called the Fitness Collective. And a lot of it is that functional type exercise. We don't do the Olympic lifting. So that's probably the main difference with CrossFit. I would say. But I think the interesting point to mention here, we open the gym, so there's 4 of us who own this, and one guy manages it. And Nick, who manages it, he had cancer. He's one of my best friends. He had cancer, and he had bone cancer. And long story short, he had to remove his toe. 5 years later, almost to the day, he was re-diagnosed with cancer again. and he had to make the decision to amputate his leg. So we were then having conversations about, you know, his job and what he does. And at the time he was a plumber and then a quantity surveyor. And he was kind of saying, you know, the exercise and rehab absolutely got me back to being healthy and fit and those kind of things. And then again, with friends, we're having breakfast. And it's like, would you ever consider opening the gym you were going to open, Foz, as I'm known to my friends? And I said, well, I will, but when my son, you know, he's 5 years old or whatever he was at the time, probably when he's 18, I might look at doing that. Blah, blah, blah. They said, well, why don't we do it? Why don't we just open a gym? And I said, I'll tell you what, I'll send you the business plan. You know, thinking they're not really bothered. Genuinely, my version of the story is that I sent them the business plan, and then Nick, who runs the gym, the guy who had cancer, literally quit his job. And I decided, I said, well, I'll mentor you then. You do your post training, I'll mentor you. We'll try and open a gym. He did his qualification. I mentored him. And 12, 18 months later, and it was a long time of looking at how we did this gym and the rest of it, we opened a gym. And that's been, I mean, timing wasn't great. It was 2020, January 2020. So COVID was a bit of a killer, but we're still open. We're going well. Everything's great. And Athlete actually did contact me asking about the potential of sort of looking at something with cancer due to Nick. And the conversation probably never ended up going anywhere. So Athlete, I'm going to tag you if you're listening. Yep. We could probably have that chat again.
I'm sure
I'm sure she'd be very interested. It's one of those, we're all very busy, but I did want to mention that just because the exercise side of things, I think we will touch upon, is of interest to us both. I think so. So yeah, I thought that'd be news you might be interested in.
That certainly is. How on earth do you fit it all in?
Well, yeah, good point, good question. And let's say if the dean's listening, I meet with him. I meet with the manager like for an hour a week. So he runs it. You know, I go in and train a couple of times a week and meet with him. And realistically, Nick runs the show. So that's how I fit it in with strong people around me. Let's put it that way. Fair. Yes. So today we're not here to talk about that. We're here to talk about the recently approved by the NHS, the drug Anastrozole. Have I got that right? Anastrozole. I knew I'd messed that up.
I think people pronounce it different ways. Don't worry about it. But Anastrozole.
And when it seems to have, you know, huge potential in preventing breast cancer. So we can touch upon that, and we will get to that. But before we do, can we kind of have a look at what breast cancer is and how it develops, and, you know, how many people does this affect in the UK?
Sure. So it is one of the most common cancers across the world. It's number 2 out of the big 4 that they call them. In the UK, 1 in 7 females, they estimate, will be diagnosed with breast cancer at some point in their life. And between the years of 2016 and 2018, it accounted for 11,500 deaths. So survival is actually pretty high. We've got about 76% survival rate of people who have been diagnosed with breast cancer and survive 10 years beyond their diagnosis date. So it's pretty good survival odds, but obviously we would love to lower it because it's such a big cancer. It's one of the most common ones. The more we can prevent it, the better. So you asked how it develops, what causes it. I think without going into too much biochemistry detail here, I'll put on my as simple as I can hat and describe what happens in cancer. So cancer in general, not just breast cancer, but all cancers are caused by 2 major things. One, a mutation in the DNA that causes the cells take on a new persona almost that helps them to grow more rapidly and divide more rapidly. And they also don't listen to the normal signals that tell the cells to stop growing and die off when they should, when they've got this DNA damage. And then there's also a failure in the immune system. So normally our bodies are really good at regulating that and spotting cancer cells, rogue cancer cells, and eliminating them quite quickly. But sometimes when you just have that, is the perfect storm really, and the unlucky event of having a lowered immune system and a series of mutations that are going to cause these cells to grow out and form a lump, a tumour. So
thank you for giving us the brief explanation and you know, and not digging too deep, but feel free to dig deep. I'll ask the questions that I feel sure. You know, I need understanding for, which may help other listeners. So thanks for the brief overview with that. So are there any people that are kind of more susceptible to breast cancer or cancers in particular?
100%. So women who are postmenopausal and not undergoing hormone replacement therapy. So basically what happens in women when before menopause, our ovaries produce all the estrogen. And when we go through menopause, suddenly that stops. And instead, our bodies have to rely on estrogen produced by our fat cells. So this is why it's often quite common for women to put on weight as they go through menopause and find it really hard to lose it after they've gone through it as well, because your body's kind of clinging on to it. It wants this source of estrogen. Obviously, we also live in a society where food is freely available, not freely available, we have to pay for it, but it's much more accessible, and it's really calorie dense food. So there's an awful lot of people who are overweight or obese, and it's this population of patients or people who are more at risk of developing breast cancer. So postmenopausal and slightly overweight or obese individuals, because they've got excess fat cells which produce excess estrogen, which is what drives the growth of breast cancer.
Are there other risk factors that are kind of around this as well? Because I know from what I've seen, there's potentially things like alcohol or red meat or other things. Are there other factors?
Yes, there are. So alcohol consumption definitely does increase levels of estrogen or free floating estrogen around the system. Red meat, there is some evidence that it might do, but eating things like a diet that's rich in leafy greens and rich in protein and low in saturated fats and low in refined sugary foods, anything that basically contributes to putting on weight and being obese, these are the things that might enhance the risk as well, or lower the risk, depending on how you're looking at it.
Is there any elements here of, I'm just trying to think out loud really. So in terms of preventing, we're talking about staying healthy, as we would term that. What would we term healthy in these risk factors you mentioned before? So what would the healthy weight be? Are we looking at BMIs, body fat percentages?
Yeah, I mean, you can look at BMI. It's obviously not a perfect measure, but it's a good standard measure that we have. Ideally, keeping our BMI between 20 and 25. That's the healthy weight range or the healthy BMI range in individuals. So maintaining a lean body mass. So the more, even if your BMI is slightly high, if you're more muscular and less of the sort of wobbly stuff that you can pinch around the middle, then that's going to serve you well. People who tend to store fat around their middle, we used to call this the apple-shaped versus the pear-shaped figures in women. If you're apple-shaped and you're prone to laying down fat around your midriff, you're a higher risk anyway, because it's that visceral fat around the midriff that will provide lots and lots of estrogen. And then maintaining a good active lifestyle. So there is evidence that even separating out BMI and weight, if you are active, you will have less estrogen floating around your system than if you are inactive.
Okay, we might get back onto that and provide some recommendations for people at the end. You mentioned kind of the general kind of diet that we have, and we know that we tend to eat more processed foods and potentially dairy or red meats and things like that. I think there's been some research potentially around like the Mediterranean diet. So what is it in that diet that's more beneficial? Okay,
so what we tend to eat, or not you and I, but like over here in the West, they call it the Western diet or the standard American diet, which is rich in or high in sugars and saturated fats. It's processed foods. The Mediterranean diet is classically more whole grains and seeds and legumes and fresh vegetables, berries, cruciferous vegetables like your broccoli and cauliflower. They use olive oil instead of, say, sunflower oil or butter or whatever to cook their foods as well. They don't tend to eat as much in the way of eggs and milk and cheese and other kind of red meats and processed meats. They tend to steer more towards chicken, fish, or vegetarian dishes as well.
And have we seen that this is better for prevention or recovery, or is there much research around those type of things?
Couldn't tell you about recovery, but certainly better for prevention. So there's a guy in the States called Walter Longo. He's written a book called The Longevity Diet, which he wanted to call the anti-cancer diet, but he wasn't allowed to because the FDA wouldn't approve it. But he talks about, or what got him interested in it was he's from Italy, or he's got family in Italy, and he noted the number of octogenarians who were really, really healthy in Italy versus how people get really quite sick quite young in America when he moved across to America. So this started him down that rabbit hole of looking at what they eat versus what we eat over here in the West, and how that might help prevent cancer, help recover from cancer. Yeah, really, it's fascinating, but it's very complex.
I do know of the book. I don't know if I've looked at it in much detail. Somebody else I've seen on Netflix who's looking at all the octogenarian type different pockets around the world, and and I think there was really interesting. I can't remember who it was. I'm not sure if you do.
I don't.
But if anyone was interested in,
Yeah.
there's really interesting Netflix documentary which looks at this in terms of physical activity, diet, and I think there's some populations that have almost started to turn it around, and there's some populations where, in fact, he did some studies in the States, and there's some like towns where he's worked on changing this diet and physical activity. Anyway, people go and find it on Netflix. It's really interesting in this
really
space. Totally random from what we're talking about, but it's very interesting. So I'll be sure to have a look at that.
This is a slight aside, but I've had some students do what we call a systematic review and meta-analysis with their project with me. So this is basically looking at the literature, systematically reviewing it all, and then pulling out the data from that and then doing a statistical analysis on this. And so I've had these students do this on looking at fasting, intermittent fasting, and this fasting mimicking diet, which is what Walter Longo promotes. The idea behind it is that when you are undergoing chemotherapy, obviously chemotherapy targets all your rapidly growing and dividing cells, right? When you fast, your body shuts down all the non-essential processes, including metabolism. So things like your hair and your nails, which are typically targeted when you undergo chemotherapy, often you see people either losing their hair or getting really brittle nails. When they fast as they're going through chemo, that actually almost serves like a magic shield to protect the healthy cells, because they're no longer growing and dividing rapidly, but the cancer cells don't adhere to this, they carry on, and so the chemotherapy almost selectively targets them. But there's very little research in that at the moment, so it's not like we can absolutely say. But anyway, that sort of thing fascinates me, the role that diet plays.
It sounds like we need to do another podcast around intermittent fasting and those kind of things potentially in the future. We'll line that up afterwards. But yeah, no, that is really interesting. So I suppose we are actually here really to talk, because obviously in the news recently, we've mentioned about anastrozole. It's been recently approved. So how effective is this new drug?
Oh, it's really effective.
Not so new drug.
It's not a new drug. It's a repurposed drug. So it has been used for years to treat breast cancer. And I don't know if you know much about the breast cancer treatment process, but with certain drugs that you'll take them for 5 to 10 years after your initial diagnosis, surgery, chemotherapy. So it's called an aromatase inhibitor. An aromatase is an enzyme that helps to produce estrogen. So what happens is we have androgens in our body, like testosterone as an example, and this enzyme aromatase helps to convert that androgen to estrogen. So the drug works by blocking that enzyme so that you end up with less estrogen in the body. That's the kind of nuts and bolts of how it works. But also, if you are a lean weight and you reduce the amount of fat cells that you have, particularly around your visceral fat around your belly, then you are lowering your levels of estrogen anyway, naturally, without having to take a drug.
So the drug is very, very useful, is an active lifestyle and a good diet is the key message, I suppose.
Yeah.
How useful are we talking that they're predicting this drug will be?
So they're predicting it's going to have cancer risk, so reduce it by 50%. The Cancer Research UK have said that if just 1 in 4 of the eligible women take it, that could prevent around 2,000 cases of breast cancer. And in terms of, I don't know if you're going to ask this later on, or can I say it now about NHS?
Go for it.
The costings. So the cost of anastrozole over a 5-year course of treatment is about £78. That's nothing, is it? It's 4p a day. Versus if you were to then take this 1 in 4 women of eligible women taking it and you're preventing 2,000 cases, that could save £15 million in treatment costs, according to NHS England. So it's hugely impactful. Not only could it prevent a lot of trauma, heartache, illness, disease, potentially deaths, but we're also saving the NHS a lot of money.
So, I mean, it obviously seems like a no-brainer, and that's probably why it's been in the news, so much. You mentioned about if the population target take it. Who are the population targets? So is this for everybody, or is this just for specific people?
The people it's designed for are those who are at risk. So your postmenopausal women and those who are overweight and obese are typically within that bracket. I was doing a bit of digging into some research on the basis of one of the lines, the paper I sent you beforehand, the fact that Black women die more frequently, or there's a higher death rate amongst Black women versus white women from breast cancer. They're more at risk of developing the most dangerous type of breast cancer. It's called triple negative breast cancer. It's hard to treat because this drug, for example, wouldn't work on it. But those, if they breastfeed, for example, that can help reduce their risk as well. So these are the people who are at risk.
So they're not people who are targeted because of specific breast cancer that they potentially
not
have.
triple negative, but all women who are at risk, overweight or postmenopausal, then they'll be eligible to take the drug.
Okay, and the success rate. How much evidence do we have around this? Is there lots of evidence for over years? Because I think, has this been used post breast cancer previously?
What do you mean post breast cancer? So this has been used as a breast cancer treatment, and once a patient has had the surgery, mastectomy or whatever, they will take this drug for up to 5 years, sometimes longer, beyond their surgery.
And so this is where it's been proved to.
Yeah.
Okay, so this is where it's been proved to extend the life expectancy of people. And what we're saying is that actually taking it as a preventative measure is what this drug is going to do.
Yeah, exactly.
Brilliant. See, if I understand it, then everybody's going to understand it. That's excellent. So you've explained that very, very well. Are there any side effects from taking the drug?
Ironically, yes, they provide side effects of menopause, so hot flashes, night sweats, insomnia, things like that. But that's temporary side effects, or in most individuals, it's only temporary. You only have it for a few weeks, and then as your body adjusts, you should hopefully feel a bit more human.
So the side effects are there, but it's manageable for most people.
For most people, yeah.
Yeah. Okay. So it sounds like an absolute no-brainer that people should be taking this. But we did speak about prior to this conversation on the podcast. We spoke about this around people and medication, and we all know, people talk about this all the time. If exercise could be put into a pill, it'd be the most prescribed, and people are hoping that pill arrives one day. It seems like in the breast cancer kind of field, the pill has arrived in this sense, potentially. However, and this is probably a point that we both are interested in, the benefits of physical activity and a healthy diet, are they bigger than this tablet? We probably don't know that. It's probably a silly question. Mm-hmm. But what I'm probably getting at is, what should people be doing? Okay. Is that waiting for the drug, or is that a combination? I think we already know the answer, but
I think we already know the answer to that. But I want to circle back to that. How big is the effect of physical activity? I think it's more wide ranging. So this drug is very specific. It only targets the one enzyme, and it's not going to stop you getting breast cancer. It's just reducing your risk by 50%. So you still have a risk of getting it. You could argue that you still do if you're physically active and you maintain a lean weight. I know personally a friend who died from triple negative breast cancer, and she used to run ultramarathons. So it's not quite as simple as if you're fit and healthy, you'll not get cancer, and if you're not, you will. There's a lot more that goes into it. But I think the biggest thing that any woman can do to protect herself is try to maintain a healthy body weight. So keep that BMI, if you can, between 20 and 25. Keep active. Do as much activity as you are comfortable doing, but ideally the current guidelines is to do 150 minutes. So that could be 3 to 5 half-hour to 1-hour sessions in a week. And ideally, if it's 5 sessions, you'd have 2 of them would be, say, resistance training or weights, and the other 3 would be aerobic training. Eating a balanced, healthy diet, so rich in high in fiber, rich in leafy greens, low in salt, low in refined sugars. Moderate your alcohol consumption. Ideally, give up smoking, and try to not eat processed food. If it's got a label on it, it's not fresh and healthy. Go for the fresh and healthy as much as possible, and cook from fresh. I totally understand that it's easier said than done. I myself work a very, very busy job, and there are times when I get home from work and I do not want to start cooking from fresh. So I understand that it's not quite as cut and dried as I make out, but yeah, that's
the advice is there and there for everybody. Yet a lot of people struggle, and I think we'll probably in other podcasts can kind of talk in depth more about some of those issues and some of those problems. But I suppose the other ones as well, where you mentioned that this is a drug that targets one element, so the addition of physical activity to impact upon other elements is quite important. Are there specifically other elements that you've researched or you know around that will help in this space?
Being active and maintaining a healthy weight lowers your risk of lots of different diseases. So cardiovascular disease is probably the number 1 killer in the world at the moment. If you are healthy and maintain a healthy weight and are active, you're much lower. You have a much lower risk of cardiovascular disease. It can reduce type 2 diabetes as well. It can help with your mental health as well. So it's not just about the physical health. It can also have a huge impact on your mental health. So yeah, the effects of physical activity are wide ranging, far beyond cancer prevention.
that was the one I was aiming for, the community side of things. And obviously you mentioned CrossFit earlier, and the gym that we have. Many gyms nowadays are plugging around that, and you've got this element where, I mean, I don't know where you are. I can see your background is Loughborough, but I'm at home at the moment.
In Leicester at the moment.
So I'm at home in Nottingham. So many of us can now work from home a lot more, and that connection that you may have had socially at work has probably been reduced by a lot of people. And we certainly find within our gym that people do want to connect. So as soon as the online COVID stuff started to end and the gym was open, we stopped online straight away. There's people who are brilliant at online, good for them. We're not. We are all about that connection of those people. And I think that mental health side is this addition. So, you know, this drug, and don't take us wrong here, this drug sounds like an absolutely brilliant thing. You know, let's certainly put that across.
Many lives.
And we'll save many lives and cost, and if that's important, then brilliant. You know, but the added benefits of exercise and nutrition are vast. And I think, you know, we all know the issues with time, and, you know, with the difficulties around eating that healthy, balanced diet around that. But that social interaction and any physical activity is better than none, I think, is a huge message that personally both you and I would probably like to get across there.
Yeah, so I think a lot of people hear exercise and think I've got to go running or something like that. And they think it's about doing some grueling, intensive regime that you're going to absolutely hate. I myself, I love Les Mills Shabam. It's a dance class. I go to Hinckley Leisure Centre 3 times a week, and I do that and body combat and body pump as well. So I try to get a bit of variety. But for me, Shabam puts such a smile on my face. Even if I had the worst day at work, I know I'll come out of there with a smile on my face. So it's not about having to force myself to do something I don't like. It's about finding something that you do enjoy and then trying to incorporate as more of that as possible. And little things like when I work at home, I don't always do it, but I try to go to the toilet upstairs instead of the one just behind me downstairs, because it's a few extra steps during the day. Otherwise I'd be sitting at my computer for, 10 hours without moving.
I used to have a great routine. I've got quite a bad knee injury at the moment. My routine, I'd be at the computer at 7, I'd work till about 12, go for a run, and then do a few hours afterwards. I can't do that now. So I'm actually having to go into Loughborough much more so I can go and use Powerbase. And that kind of smile on your face type thing. In our gym, we talk about a member's gym session should be the best thing they do that day. And if they have walked in stressful, they should be walking out of there smiling. And if they're not, we've failed at our job. And that is the mantra within our gym. And thankfully, many people do, most people do walk out thinking, I'm really glad I came. And,
100%. And it's partly the people you meet, and it's partly the endorphins that are released from all the exercise that you do. And it's partly the sense of achievement as well, I suppose. So there's a whole, you're talking earlier on about, we know what the guidelines are, but we don't always do it. There's a huge piece around motivation and behavior change, isn't there? And like understanding the psychology of why we do the things that we do, or understanding the psychology of why we know what we need to do and we don't do it. And that's beyond my research experience, but perhaps Ian Taylor could weigh in on that.
Now, we've had Ian on before. He's looked at motivation to exercise. That was obviously, we threw that out there last January. So anybody who wants some motivation, go and listen to Ian's podcast. I think there's also a bit that you touched on there around exercise as well, because we can talk about going to Hinckley Leisure Centre and going and doing Shazam or and whatever. Shabam.
Although it's changing, I know you're becoming Les Mills Dance, so a bit sad, but I'm sure it'll be equally as fun.
And look, Les Mills have been very successful for a very long time, and they change things very well, and huge business model, and there's people all over the world who do Les Mills, and it's great, But the one thing we talk about in our gym is we talk about people coming to the gym so that they can do other things outside the gym. For us, community is great in the gym, but actually we want you to come so you can do all that cool stuff that you really want to do out there. Go and do it. So we hook up with a charity called Hike with Mike, and so many people from our gym go hiking once a month.
But going to the gym builds their strength, so they're able to do it more capably. 100%.
Exactly. That's the kind of thing that we really believe in. The gym is there as an essential piece to help you to live better lives. And that strength, you mentioned strength training twice a week, and your potential cardio 3 times a week. Well, we will specialize in strength training. We'll provide a lot of cardio stuff as well. But if you bare minimum just come and do 2 strength sessions a week, go for a walk, Go and play your sport.
Yeah.
Go and do whatever. Go and do your gardening, whatever it may be.
Yeah.
And that's where we really see things. Slightly conscious that me and you have spoken a little bit more about, you know, diet and exercise, but I think that's really important in this conversation. I think we need to highlight the fact that this is a great new drug, and, you know, really welcoming that it's been there. The 4p a day is, you know, something worth talking about, and the savings that can it make to the NHS. The extended life and the you know, taking this for 5 years is going to have a really big effect on a wide variety of people, particularly that target market of postmenopausal and those who are overweight or obese. But in addition to that, if people are able to, then go and do whatever exercise you can do. Change small things in your diet to send them more towards the diet that we want to. It's not a full overhaul. It's not you can only eat, you know, high fiber and leafy greens and cut out alcohol and sugar and everything. Small changes.
Yeah, I used to work with a nutritional therapist called Sarah Southgate. So after the COVID jabs, I got a really strong bout of fatigue, which she linked to having had the COVID jab. Anyway, I worked with her to try and get my health back on track. And she was trying to say to me, it's not about overhauling your diet. Add in more of the good stuff, and soon you won't feel the need for the bad stuff. And it didn't take much longer than a week of doing that before I then was basically eating hardly any sugar at all. And, you know, I haven't stuck to it completely, but, you know, the lessons that I've learned from her have really helped to embed in my mind and make me more conscious about what I choose to eat each day. So small changes.
That is the key, isn't it? Small changes. If you can't, you know, the couch to 5K, you know, it's a great initiative.
Yeah.
You know, within I can't remember what it is now, 8 to 10 weeks, you can be going from doing nothing to running 5K.
Yeah, it's about 9 weeks. So I think it's 10 weeks, but I think I got to 5K within about 8 or 9 weeks. So yeah.
It's brilliant, but it is those things, isn't it? So don't just rely on this drug. This drug is brilliant. Don't just rely on it. Go and make some lifestyle changes, whether that be exercise, whether that be diet. Go and do the exercise you love and you want to do. You know, we will have people come to our gym, and, you know, it's very rare, but they might not like it. Go and find something else then. You know, some people come in and love Zumba and things like that. Well, great, do it.
Some people will hate that. Totally. It's all about personal taste and what you're into. And one of the best things I like about going to a gym that has lots of different classes is you can try different things. So I have tried all sorts of classes at the gym, and there's some that I will not go back to because I don't love them. And then there's others like Shabam that I love so much that I'll never miss it. If I can at all avoid missing it, I'll be there.
Well, I imagine I would be the opposite of where you are with those things, because my coordination is shocking, and I look at some of these things and I go, I don't know what you're doing.
Oh, it's
Let
funny,
me just go over here.
I persuade my husband to come along, and he's like, nope. He just refuses to join me.
Well, like you said, each their own. Like, you know, personally, you could give me a barbell and I've got some coordination there, but don't get me on the dance floor unless I've had some alcohol. Then I'll be fine. But it's been really good speaking to you again, and I certainly think that we could probably hook up on a number of other conversations. The intermittent fasting one is a particular one that I'd be quite interested in talking about, and as you mentioned before, hopefully you get some of that research funding to do your work there with CrossFit and with Athlete. That would be interesting to have a look at. And if you do, by all means, you know, chat to me again, and we can get Athlete and yourself on here and have a conversation around the potential of CrossFit and impacts that may have on cancer or health in general. So really appreciate you coming on. Hopefully the audience have got a better understanding of the drug that is called
Anastrozole.
Thank you. But also the benefits of a healthy lifestyle and nutrition in enhancing people's health, but also preventing potential for getting cancer in the future. Yeah,
absolutely, 100%. It's been really enjoyable. Thank you very much.
Thanks, Mhairi.
Thanks for listening to the Experts in Sport podcast. If you'd like to get in touch, then please contact me, Martin Foster, at m.foster@loughborough.ac.uk. Thanks for listening. See you next time.